Why should you see an ENT to get your earwax cleaned? I'm Dr. Manoj Shah. I'm one of the ENTs here at the Colorado Ear, Nose, Throat Group. If you feel like your ears are clogged, or if you feel like you have too much earwax and you're having trouble hearing, you should go talk to an ENT. We can help you clean it. So first, what is earwax? Earwax is a natural substance that's made from the dead skin cells from the skin of the inside of your ear, mixing with the oils that your skin naturally makes. That earwax is acidic, and it actually helps prevent bacterial overgrowth. So earwax is actually a good thing. But everyone's body makes a different amount of earwax. Just like some people have oily skin and some people don't. Some people make a lot of earwax, and especially men, as they get older, they make hair in their ears and it gets the earwax caught. So what kind of problems does earwax cause? Well, if the earwax gets built up, it can literally make it hard for the sound to hit your eardrum, and it makes it hard for you to hear. So how do we clean it? As an ENT, we use a couple different tools. The first thing we might use is if the earwax is like hard and easily seems like it's going to come out one part, we might use a tool called a curette. This tool allows us to gently, under a microscope, pull the earwax out. Now, an ENT is going to use a microscope. That is an important tool that allows us to actually visualize things, because when people try to do this at home, it's very easy for them to hit the eardrum and damage their own hearing, versus an ENT can use a microscope to make sure we know where we are. If the wax is soft and it doesn't look like it's going to come out, we actually have a suction device that we'll put in, and it will gently suction things out. But again, it's incredibly important that we do it under a microscope so that we know that we're not going to hit the eardrum and cause damages. Part of the reason we recommend going to an ENT to get your earwax cleaned is some people think you can do an irrigation, which is when you spray water in. And in some situations that might be enough to wash it out, but I, as an ENT, have seen lots of eardrums that have been ruptured and damaged from the water having too much pressure. The skin of your eardrum is incredibly thin, and so if you put a lot of high pressure water in it, you can rip it and cause damage to your hearing, or even get a bad ear infection. So again, the most important thing is if you have bad earwax, you can always try some of these ear oil drops. So if we can't get the wax out, we may even have you do that at home, where we'll have you use some ear oil, like Debrox, to soften it up. And over time, it should naturally come out, but that doesn't happen for every patient. And if that's the case, please come see an ENT and we'll get it cleaned. If you have any questions, we'd love to ask them in the comments below.